honourable member for Calgary-South East, followed by Olds, Didsbury, Three Hills.
Thank you, Mr. Speaker, for the opportunity to rise today. As you know, Mr. Speaker, I am a paramedic and I'm proud to be that. I'm also proud to be the MLA for Calgary-South East. Over these last many months, I've had the opportunity to talk about emergency medical services, and that includes Air Medevac. I've been a paramedic who's worked on the street and continues to try to work on the street to be relevant and to be genuine. In that, there are things that are unpleasant with that job. And unfortunately, I've been there. I've been there when things have gone wrong, but I've been there when things have gone great. But that emotion, it wells up and it compels us to advocate for our patients. It advocates us, it causes us to do things that might normally wouldn't. And sometimes we have a hard time understanding. And when we get to that point in emergency medicine, Air Medevac, or anything else, the only thing we have to rely on are the facts. And I wanted to release some of the facts here in this House today. Last year, there were 371 flights, Air Medevac flights, air ambulance flights with paramedics, very skilled and highly trained people. And they can't do their job without nurses and without physicians that also care and advocate for their patients and are emotional and have been on that scene, have been there and seen the carnage, but they've also seen the great opportunities and the great success stories. Of those 3,071 flights, there were 505 red patient flights flown into the provinces, to the city of Alberta. And out of those flights, 282 were sent to the University of Alberta, 161 sent to the Royal Alexandra. And when we talk about red patients, they're life-threatening, absolutely. But there's a scale on that. And what Alberta Health Services has done is they've looked at that scale. They've calculated as the call came in, because the call coming in, the first part of that call is very important, from the beginning of that call to the very end. So what they did is they calculated the flight coming in and they graded it. So those life-threatening calls, 505 coming into the city of Edmonton, went to various hospitals, many of them ICU patients. They went to all of the various hospitals. At the end of the day, they took a look at all that information, they calculated, they took the patient care reports at the end of that, and then they reevaluated it. That's what those numbers come up. It's medical-based evidence that moves us forward. It's what makes this healthcare system the best in this country.